lot.
Thank
We
you.
have Dr. Navneet Toshniwal. He is a teacher of teachers. He's written two books on phaco emulsification. Today he is going to discuss happenings in phaco surgery. Over to you, Navneet.
Uh, Thank you, Jignesh. Respected chairperson, co-chairperson, and colleagues. This is a very simple topic that is a happening in phaco surgery. If you really record your each and every case, in every case there is a something will happen which you don't know. And I always stress this, record your every case and then you will get. I have a collection of around 500 cases around the something different thing has happened. We will see some of those. This is the just we have listened the topic of zonular weakness. This is the very good instrument Toshniwal microcapsular axis forceps here in Sunena surgical. Although we are using the good forceps also, you can see the two bands has been stretched out, and this is normal thing. Now what to do at that point? Take the point which is closer, and here the speed is very important, that one jerk to correct the capsular axis. So it is the speed of capsular axis which is needed at this particular point. If you will go slowly, it will run away. Now in this case particularly, you can see the cortical cataract at one zone, and before surgery I thought that there may be some zonular weakness can be there. I don't know, it may be micro. And then I notice here you can see that bluish discoloration, trypan blue has gone behind the vitreous. And now the things are different. Here you have to take all the precaution as if you are doing a case of zonular weakness. So all the things are ready. This is the microcapsular axis forceps, very unique design instrument. I have already mentioned with the Sunena surgical here. And then I don't do hydro. Believe me, this is not a very good platform to say. Last 15 to 20 years, I have stopped hydro. I don't do rotation, I don't do no hydro, and directly start the trench. Trench in the center. This is stop and chop technique. And then with the another new design instrument, this is the pre-chopper. I just divide the nucleus into two pieces, equal half. Although there is a zonular pressure weakness, there is a equal pressure, so it will not get damaged still more. Then lift out one piece out. You can directly chop it at the level of rhexis if nucleus is not very big, or you can chop in one or two pieces, but the level of capsular axis plane or just supracapsular plane. All the things are in my mind, that there may be some dehiscence in the zonules, where exactly I don't know. So intra bag manipulation, you have to be very careful. See, I am not rotating, just lifting other half. And already I mentioned with the good cutting machine, this is at a very nice plane. And now you can see, now this is the empty bag without nucleus. You can see clear cut. Something is behind. Bimanual is ideal, but I generally use the coaxial irrigation aspiration. This is also very unique 45-degree angle from MST, USA. Very unique design instrument I am using from 20 years. It's absolutely no problem. But you have to take precaution everywhere. Each quadrant slowly, little bit pull, go in the center, little bit pull, go in the center. And still I was in dilemma that what is going to happen, I don't know. And this is what I try to mention, that anything can happen during the surgery. You should know the clear cut concept, you should have the clear cut idea. Now, sub incisional cortex is difficult. Try to do it. Otherwise, leave it, put the IOL, and then remove afterward. That's very simple. I have put the lens, and now one interesting point, when I started the aspiration of the viscoelastic, I found that trypan blue color dilutes or something, whatever thing has gone behind, I was just aspirating the things and there was a dilution of this trypan blue. Otherwise also, this trypan blue in a 1 or 2 days, it will, you will not get a severe reaction or like that. This is the generally. And last night when I was doing removal pieces, something as plastic was there. I have removing with this micro forceps, and that's all. So there are, this is the way, there are many things can happen. You should be ready with these things. And when it's not a high volume surgery, it is whatever you do, you should be ready with the things, and anything can happen. My sincere appeal is record your cases, each and every case. You will get the new point every day, and you can learn by your videos. Thank you. Thank you for
Very
your precious
nice,
time.
Navneet. Just 2 or 3 questions as you are writing books on phaco for the beginners. What are your phaco parameters for a standard cataract surgery?
See, ideally in phaco 1, during the trench, energy is most important. Vacuum and flow rate should be less. For phaco 2, hold and chop, vacuum is the most important. Flow rate just to pull the piece. So vacuum in a panel mode around 300 millimeters of mercury in a routine cases. Flow rate 25 to 30. And when you are removing the pieces, if you are in a panel mode, you have to be careful when you are putting your phaco tip periphery. So if it is linear mode, vacuum and flow rate, you can easily manage. No problem. But if you want to take your pieces quickly out and all that, so that is the phaco fluidics. That is very important. At that time, if you keep the flow rate in a panel mode, decrease the parameter. Maybe 28, 20, 30 like that. It should be in a control way, and many factors are there, chamber depth, how many instrument, how many incision you are using. So these are the other factors for phaco fluidics.
Do you use the epinuclear mode while you finish all the thing?
Yeah,
only
last
a thick-
pieces,
yeah.
last pieces, especially epinuclear mode, immediately you should go. As a routine, you should go. And I try to avoid removal of the epinucleus with the phaco tip. If it is a bulky mass, it is indicated to remove with the phaco tip, then remove. Otherwise, irrigation aspiration for the epinucleus.
What is the parameter for epinuclear modes?
Generally 15 to 20 flow rate and 300 around vacuum.
Vacuum.
This is the general parameter.
Perfect. Thank you very much. Any questions anybody has? He can always utilize his good services. He is a teacher of teachers.
I will
Any
just
questions you have, please let us
take
know.
the opportunity. I have written 4 books in phaco surgery. Simplified phaco emulsification, how to see the patient on slit lamp before surgery. Third book is do's and don'ts, and fourth book is very unique book. It is on a phaco machine. It is only 75 pages book. I think it should, everybody should have, and you should add more points in that. Thank you.
Thanks.